Today, we are talking about aging and some of the big issues facing older people. During the next 5 years, we will see the peak of retirements for baby boomers. Right now, more than 55 million people in the U.S. are 65 or older. That's 16% of the population. And many are still working. More than 16% of people 65 and up are on the job, and they are the fastest growing segment of the workforce. Aging comes with some significant and familiar challenges. Nearly 3/4 of Americans will need assistance from caregivers to age in their communities. So issues surrounding aging are social, political, and financial, and the demands are only increasing. Joining us now is Sandra Harris, the AARP Volunteer State President for Massachusetts. Hi, how are you today?
I'm fine, Karen. Honored to be here.
Lots of data. The nation faces a looming senior care crisis, with nearly 70% of older adults projected to need long-term care services. And former President Donald Trump's policy platform, released this past summer, says he would shift resources back to at-home senior care and support family caregivers through tax credits. Vice President Kamala Harris proposed the first ever Medicare benefits for home health care last week on The View. Now, right now, Medicare doesn't cover long-term care. So why is it important for the candidates to address this issue, and what are the benefits of the option to age at home?
Oh, I think it's very important for all sides, all political sides, to address this issue, because we know that for the most part, people want to age at home. They want to live at home. They're not interested in going into facilities, and we need to make sure that we have not only the caregivers and the support for caregivers to support that, but also that we have the home-based community programs to support that as well. I mean, making sure that we have an adequate workforce to come into the home to help to care for those. So those are all very, very critical. Both are very, very critical. And we're hoping that we can come up with bipartisan solutions to addressing both of those needs.
In fact, both of my parents insisted on aging at home, late into their 90s. The nursing home sector has faced workforce and financial challenges, and the pandemic just made it worse. Governor Maura Healey signed a bill last month that improves access to high-quality care for the elderly, and it requires, in part, that MassHealth will review nursing facility rates every 2 years, establishes a new fund to support grants to develop new certified nursing assistants and licensed practical nurses, and requires long-term care facilities to develop individualized outbreak response plans. Are enough resources being dedicated to seniors in long-term care?
Well, I think that's a major help, but I do think there's a lot of work to be done. I mean, I think when we look back at COVID and saw the dismal failure of what was happening in nursing homes and how we desperately need nursing home reform even before COVID. So it's very, very encouraging to see, and then we think that, you know, there are other things that need to be done, other things that we were hoping to have included in the bill, but I think that's a very, very good beginning.
Now, you're a co-chair of the Massachusetts Coalition to Build Community and End Loneliness.
Absolutely,
yes. What makes loneliness an important issue for the senior community?
Well, we know that loneliness impacts health, and there's a lot of risk into being loneliness. We know that it impacts things like, you know, cardiovascular disease, dementia, premature death, depression, you know, all those kinds of things. So it's really important. We've spent a lot of time talking about wellness and well-being, and spending a lot of time talking about physical and mental health. But the third pillar, and the missing language in that, is social health. Mm-hmm. We were not designed to be social beings. You know, I mean, we are designed to be social beings. We're not designed to be lonely. So we now are saying, and our message is, we need all three for good well-being and good health.
So tell us more about what the coalition is doing to build community and to end loneliness.
Well, one of the first things that we've done is develop a public awareness campaign, because when we went out into the community to try to make an assessment to understand the impact and how it was manifesting itself in community, we found out very quickly that people just did not understand the risk of loneliness. And for those people who wanted or at least admitted to loneliness, there's a stigma attached to it, right? They didn't want to admit that they're being. So we started, first of all, a very public awareness campaign where we talk about all the benefits of staying connected. We've actually started a lot of programs, and we have what we call guiding principles, one of which is that we wanted to make sure that we were rooted in community. We wanted to work on communities and work with organizations. So we started in 2019 with about 6 organizations. We now have 137 organizations statewide working. So it's truly a movement in Massachusetts.
That's amazing. Amazing. You know, affordable housing, of course, is another critical issue for seniors. Again, this summer, Governor Healey passed a bill allowing accessory dwelling units, or ADUs as they're called, or on single family lots. Building an ADU is expensive. Is there an equity issue perhaps buried in here? What is AARP's view on this housing solution?
Well, we certainly salute the governor for passing the bill. It's a historical and the largest investment in housing in the Commonwealth. And one of our chief priorities in that bill was ADUs, or accessible dwelling units. But we do know that it's expensive. But at least we have, for those people who have the resources in place now, they can begin doing it at right. And I know that just as we're looking for funds for home-based and community care, then funding and help needs to be included in that work, and trying to make those accessible for those people who can't afford them.
So, of course, unless you're living under a rock, everybody knows we have an election coming up. Voters 50 plus are the majority of voters in every election. AARP does its own polling. What issues are popping up as the most important in this year's election from your voting block?
Well, you know that 50 plus is the largest voting block, and they probably will determine this next election, right? The things that we are really seeing and hearing about is, you know, protecting Social Security, which is critical. You know, if we don't do anything about this, if Congress does not come together on a bipartisan solution, then in 10 years, you know, the Social Security fund will be deflated, and people can face up to 20% of their less benefits if that happens. And think about it, so many people, that's their only source of income.
Sure.
Imagine how that's going to impact them. So Social Security and strengthening Social Security and looking for a bipartisan approach to addressing the Social Security issue is very important. Caregiving is critical. You know, not only, you know, we say that there are 3 people in the world: those who are providing care, those who are giving care, and those who will need care, right?
Yes.
And that becomes increasingly important. And we just really need to be able to support family caregiving. So that's very critical. Housing is an issue. Affordable and accessible housing is critical. And then we have things like home and community-based care, making sure that we have the resources to keep our loved ones at home. And then, of course, we will continue.
A lot of key issues. Central Boston Elder Services is going to be joining us shortly in the program, and you're the keynote speaker for their upcoming 50th anniversary gala event. Is there a particular message or theme that you're looking forward to sharing at the event?
Yes, I do. I'm looking looking back and making sure that we're honoring and giving kudos to the founders and the visionaries who started it, and looking at where we are today and all of the good work that's going on with the association, as well as looking to the future and the kinds of things that we have to be taking care of so that we continue to carry that baton for the visionaries who started this work.
All right, Sandra Harris, thank you. And I look forward to seeing you at Central Boston Elder Services. Up next, helping seniors remain independent, the organization that is offering some critical services when Cityline continues.